Welcome to Dr. Amanda Clarke, Heart Health and Cardiology. Today we are talking about the 5 warning signs your heart is in danger that most doctors miss. Let us get into it. I want to start with something that might make you a little uncomfortable. Think about the last time you went to see your doctor for a routine checkup. How long did that appointment last? 15 minutes. Maybe 20. In that brief window, your doctor is checking your blood pressure, reviewing your medications, asking about your general health, addressing whatever brought you in that day, and trying to stay on schedule for the next patient waiting outside. They are doing their best within a system that gives them very little time to do it. And the result, through no fault of anyone involved, is that certain warning signs that deserve careful attention sometimes do not get it. Not because your doctor does not care, but because the appointment ended before the conversation could get there. Today I want to have that conversation with you, the one that does not always happen in the 15-minute appointment, because there are specific warning signs that the heart sends out, sometimes months or even years before a serious cardiac event, that are consistently under-recognized both by patients and sometimes even by the medical system. Signs that get attributed to aging, to stress, to being out of shape, to 100 other explanations that have nothing to do with the heart. And the gap between recognizing those signs early and missing them entirely can be the difference between a life-saving intervention and a crisis that arrives without warning. By the time you finish watching this video, you will know the 5 specific warning signs we are talking about today, why each of them gets missed so frequently, what the medical research actually says about their significance, and exactly what to do if any of them apply to you or someone you love. Stay with us, because the 5th warning sign on our list is the one that surprises people most, and it is the one that is most consistently dismissed as something completely unrelated to the heart. Before we get into the 5 signs, let me give you one number that sets the stage for everything that follows. Heart disease is the leading cause of death in the United States. It claims more American lives every single year than any other cause. 1 in every 4 deaths in this country is caused by cardiovascular disease. And the research is clear that in a significant portion of those cases, the warning signs were present beforehand. They were there, they were felt. They were simply not recognized for what they were. That is the gap we are here to close today. The first warning sign is one that most people have experienced at some point, and almost nobody connects to their heart. Unusual fatigue. Not the tiredness that comes from a hard day at work or a poor night of sleep. Not the fatigue that lifts after a weekend of rest. The kind of fatigue I am talking about is different in character and different in how it sits in your body. It is a heaviness that does not respond to rest in the normal way. A tiredness that seems to come from somewhere deeper than lack of sleep. A reduction in your capacity to do things that previously felt effortless. Not because you are out of breath or in pain, but because your body simply does not have the energy it used to have. This kind of fatigue happens when the heart is not pumping blood efficiently enough to meet the body's needs. When the heart is struggling, whether because of developing coronary artery disease or early heart failure, or other forms of cardiac dysfunction, the body begins to prioritize blood flow to the most vital organs. Muscles that are not actively needed at that moment receive less oxygen, rich blood. The result is a general sense of depletion that does not track neatly with activity level or sleep quality. People describe it as feeling older than they should, as running on empty without a clear reason, as just not feeling right in a way they cannot quite put into words. Now here is what most people never find out. This type of fatigue is particularly common as an early warning sign in women. Research consistently shows that women are significantly more likely than men to experience fatigue as a primary cardiac symptom, rather than the classic chest pain that most people associate with heart problems. Studies have found that more than 70% of women who have heart attacks report unusual fatigue in the weeks and months preceding the event. 70%. And yet, when women bring this symptom to medical attention, it is frequently attributed to thyroid issues, to anemia, to depression, to the general demands of a busy life. The cardiac connection is made far less often than the data suggests it should be. Ask yourself honestly, have you been feeling more tired than usual in ways you cannot fully explain? Not occasionally, but consistently, over a period of weeks or months. If the answer is yes, and particularly if you have any other cardiovascular risk factors, that is worth a direct conversation with your doctor about your heart, not just your thyroid, not just your sleep, your heart. The second warning sign is shortness of breath that seems disproportionate to what you are doing. This is different from being winded after a hard run or feeling breathless after climbing multiple flights of stairs quickly. The warning sign I am describing is breathlessness that does not match the activity that triggered it. Getting short of breath walking from the parking lot to the grocery store entrance. Finding yourself breathing harder than you should climbing one flight of stairs at a comfortable pace. Noticing that activities you did easily 6 months ago now leave you slightly breathless in a way that did not used to happen. This symptom occurs because when the heart is not pumping effectively, fluid can begin to accumulate in the lungs. This is called pulmonary congestion, and it is one of the classic signs of heart failure developing over time. The lungs become less efficient at exchanging oxygen and carbon dioxide, and the result is a sensation of not being able to breathe deeply enough or comfortably enough during physical activity. People often attribute this to being out of shape, to gaining weight, to getting older, to not having exercised enough recently, and sometimes those explanations are correct. But when this symptom is new, when it represents a change from how you felt before, and particularly when it is occurring at lower activity levels than it used to, it deserves medical evaluation directed specifically at the heart and lungs. And this is the part that genuinely surprises most of my patients. Breathlessness that wakes you from sleep, that causes you to need to prop yourself up on extra pillows to breathe comfortably, or that seems worse when you lie flat, is a particularly significant cardiac warning sign. If you have noticed any of those patterns, sleeping with more pillows than you used to, waking in the night, feeling like you cannot catch your breath, please make an appointment with your doctor and specifically describe this symptom and its relationship to your sleeping position. That detail matters, and it is information a cardiologist needs to hear. The third warning sign is swelling in the ankles, feet, or legs that cannot be explained by something obvious, like a long day of standing or a long flight. This type of swelling, which doctors call edema, occurs when the heart does not have enough pumping strength to move blood efficiently from the lower extremities back up to the heart and lungs. Fluid accumulates in the tissues of the legs and ankles under the influence of gravity. People notice that their shoes feel tighter than they used to by the end of the day, that there is a visible puffiness around the ankles that was not there before, that pressing a finger into the swollen area leaves a small indentation that takes a moment to fill back in. That is called pitting edema, and it is a recognized sign of fluid accumulation in the tissues. But here is something your doctor may not have had time to explain. Leg swelling from a cardiac cause often comes with other symptoms. Unexplained weight gain of 2 or 3 pounds over a short period, not from eating differently but from fluid retention. A feeling of abdominal fullness or bloating that is unusual for you. And importantly, swelling that is worse at the end of the day and better in the morning after you have been lying down for several hours. That pattern of improvement with lying down and worsening with sitting or standing is a characteristic of cardiac edema specifically. If that pattern describes what you have been experiencing, it is not something to attribute to too much salt or too much time on your feet. It is a conversation to have with your doctor about your heart function. Let me tell you about Michael. He was 54 years old, a warehouse supervisor from Georgia, someone who spent most of his workday on his feet. He had noticed for several months that by the end of his shift, his ankles were visibly swollen. He assumed it was from standing all day. He bought compression socks. They helped a little, but not as much as he expected. His wife noticed that he seemed to be breathing a little harder, going upstairs at home, and mentioned it to him, but he dismissed it. It was only when he went to his doctor for a work-related health screening that the doctor noticed both the ankle swelling and the slightly elevated resting heart rate and ordered further tests. Those tests revealed that Michael had developed heart failure in its early stages. Caught at that point, his condition was manageable with medication and lifestyle changes. His doctor told him directly that if he had waited another year, the situation would have been significantly more difficult to treat. The fourth warning sign is irregular heartbeat, or palpitations that are new, frequent, or accompanied by other symptoms. Most people have felt their heart skip a beat at some point. An occasional extra beat, or brief flutter that passes in a second and then disappears, is generally not cause for alarm in an otherwise healthy person. But palpitations that are new, that occur regularly, that last for more than a few seconds, that are accompanied by dizziness, or lightheadedness, or shortness of breath, or that are noticeably different from any heart rhythm irregularities you have experienced before deserve medical attention. The most common arrhythmia in the United States is atrial fibrillation, a condition in which the upper chambers of the heart beat chaotically and out of coordination with the lower chambers. Atrial fibrillation affects an estimated 6 to 7 million Americans, and that number is growing. Many people with atrial fibrillation describe the sensation as a fluttering in the chest, a racing feeling, a sense that the heart is beating irregularly or too fast, or simply a feeling that something is off inside their chest that is difficult to describe precisely. Some people have no symptoms at all and discover the condition only when a doctor finds it during a routine examination. Others notice it clearly but attribute it to caffeine or stress or anxiety and do not pursue evaluation. Here is the number that should concern every American about atrial fibrillation specifically. People with undiagnosed and untreated atrial fibrillation have 5 times the normal risk of having a stroke. 5 times because the chaotic beating of the upper chambers of the heart allows blood to pool and potentially form clots. Those clots can travel to the brain and cause strokes that are often severe and life-altering. The single most important thing about atrial fibrillation is catching it. Because once it is diagnosed, it can be managed effectively with medications that dramatically reduce the stroke risk. But undiagnosed and untreated, it is a hidden threat with consequences that are far out of proportion to the relatively mild symptoms it often produces. If you have ever felt your heart racing or fluttering in a way that seemed irregular, if you have experienced episodes of dizziness that came on without an obvious reason, or if you have noticed that your heart seems to pound in your chest at times when it should not be working hard, please mention this specifically to your doctor and ask whether a heart rhythm evaluation would be appropriate. The 5th warning sign is the one I told you would surprise you, and it is this: persistent jaw pain, neck pain, or upper back discomfort, particularly on the left side, that has no clear musculoskeletal explanation. This warning sign is so consistently overlooked and so persistently attributed to dental problems or muscle tension or stress that entire cardiac events happen while people are visiting their dentist or their chiropractor rather than their cardiologist. The reason this symptom happens connects to something called referred pain, which we discussed in our previous video on silent heart attacks. The heart and the jaw and neck and upper back all share nerve pathways in the body. When the heart is in distress, those pain signals can travel along shared pathways and register in the jaw, the neck, the throat, or the upper back, rather than the chest. For many people, particularly women, this is not a secondary symptom that occurs alongside chest pain. It is the primary and sometimes the only symptom they experience during a cardiac event. A jaw that aches persistently for no clear reason. A neck that feels tight and uncomfortable in ways that massage or stretching do not resolve. An upper back that aches between the shoulder blades in a way that does not feel like a muscle strain. Now here is what the research actually shows about how frequently this warning sign is missed. Studies have found that cardiac symptoms in women are misattributed or dismissed at significantly higher rates than in men. Women presenting to emergency departments with heart attacks wait longer to be seen than men presenting with the same conditions. They are less likely to receive certain diagnostic tests promptly, and they are more likely to be told their symptoms are anxiety or stress-related before a cardiac cause is ruled out. That pattern has real consequences. Women under 65 who have heart attacks have significantly higher in-hospital mortality rates than men of the same age, partly because their atypical presentations lead to delays in treatment. If you have jaw or neck or upper back discomfort that is persistent, that comes on with physical exertion and goes away with rest, that wakes you at night, or that is accompanied by any other symptom on this list, please do not assume it is dental or musculoskeletal without having a doctor specifically consider and rule out a cardiac cause. First, so what should you do with the information in this video? The most important thing is to take these warning signs seriously if they apply to you. Not with panic, not with catastrophizing, but with the calm, deliberate decision to make an appointment and have a direct conversation with your doctor about what you have been experiencing. Describe your symptoms specifically and completely mention how long they have been present. Describe their relationship to physical activity and to rest. Ask your doctor directly whether a cardiac evaluation is appropriate given what you have described. The second thing is to understand your risk factors. High blood pressure, high cholesterol, diabetes, smoking, family history of heart disease, obesity, and physical inactivity are all conditions that dramatically elevate the significance of the warning signs on this list. If you have multiple risk factors and you have been experiencing any of these symptoms, the urgency of getting evaluated is higher than it would be for someone with no risk factors at all. And the third thing is to be an advocate for yourself and the people you love. If you describe symptoms to a doctor and they are dismissed without adequate investigation, it is completely appropriate to ask for further evaluation or to seek a second opinion. You know your body. You know when something feels different than it should. A warning sign that gets taken seriously and turns out to be nothing is a far better outcome than one that gets dismissed and turns out to be something that could have been treated. Your heart works every second of every day without rest for your entire life. It deserves the same attention and care you give to every other aspect of your health. And the warning signs it sends, even the quiet ones, even the ones that seem like nothing, deserve to be heard. If this video gave you a clearer picture of the warning signs that too often get missed, and what to do if any of them apply to you, subscribe to Dr. Amanda Clarke and turn on notifications so you never miss a video that matters for your health. And drop a comment below answering this question honestly. Have you ever experienced any of the 5 warning signs we discussed today and dismissed it as something else? Your answer might help someone else in this community take their own symptoms more seriously. Every comment matters and we read them all.